lack of time is crucial, but I don't know how much of it's it's lack of time because all these people need to be seen, and so we just have to work to get them all in, or how much of it is just like, well, our reimbursement also happens to be per patient that we see, not how healthy we help them stay. And there's reimbursement tied to procedures, and there's reimbursement tied to not so much to outcomes, but to just doing things. And that works really well for the companies that make the pills and that make the procedures. And it's the model that we work in. And so by seeing, 4 patients in a day instead of 14, that's 10 patients that didn't get to be seen at all, and they may be suffering. So there's that, unbeknownst to me because I didn't see them today. But, if you do a better job for those 4 patients, you might not need to see them as frequently, and they're not going to have as many of the same illnesses, or their illnesses are going to be better, and they're going to skip the procedures. And I'm not able to work these algorithms completely, but being theoretical about it, I think the needs will be met if we make the visit about quality and less about just seeing a whole bunch of patients in a small amount of time.
Welcome back to the Yogi Triathlete Podcast. We are Jess and BJ, and this podcast started from a desire to share stories of purpose, but also to spread the message that living a more vibrant life is within reach for all right now. It could be what you put on your plate today. It could be the mental nutrition that you entertain, or it could be cleaning out a closet. A vibrant life is full spectrum. It's not just one thing, and there are no shortcuts. But as good habits become the norm, a healthy lifestyle becomes effortless. At least that's what we have found, and perhaps our guest today will agree. Dr. Jeffrey Pierce is a board-certified family physician who uses diet and lifestyle choices to guide his patients to a longer and healthier life. He is a part of the esteemed community of docs that comprise the Plant Based TeleHealth team, and currently is seeing patients both in person and online from his home base in Northern California. He believes that with the right information and motivation, that people can get to the root cause of their dis-ease and heal themselves, which I believe is a sign of a brilliant doctor who is focused on healing the whole person and empowering them as a part of his process. We've been looking forward to this interview. Dr. Pierce, welcome to the show.
Wow, thank you so much. It's a pleasure to be here.
Yeah, well, it's a pleasure to be able to read that intro and to be sharing the story of somebody who really is looking at healthcare from a place of healing, healing the whole being. And I can't remember her name. I'll probably remember it by the end of the podcast. Oh, Gerson. Many, many years ago, I think is this documentary called like the Gerson method or the Gerson effect. And it was this whole juicing thing. I was living back east, but it was this whole, like, if you have cancer or whatever, you go to this clinic in San Diego and it's like you juice, you're put on a raw, you're healing yourself with food and mindfulness practices and things like that. That's beside the point. But what I took away from that, which I have never forgotten, is she says, her name is Charlotte Gerson, that's it. And she said, when one thing heals, everything heals. And I don't know if you agree with that, but also I kind of flip that, and I think if one thing is off balance, we're completely off balance. That, as somebody, I was a massage therapist for a long time, so I studied the structure of the body. And what I learned is, like, we're all just one big piece, that thing in your ankle could actually be your right shoulder. And so I guess that's my first question, is asking you, from this perspective of healing, have you seen that other things will heal as the object of your focus is healing?
Yeah, that's a great question and a great thing to start off with. I learned in medical school a lot about individual conditions and individual diseases. And we were taught to, give this medicine for that and the other medicine for this other thing. And they were fairly disconnected. And the more I've done the more I've practiced medicine and the more I've learned about lifestyle medicine and how what we eat and how we move and how we sleep and how we think and the community that we have around us, the more I've learned how these processes are so interconnected. And one way that was driven home was when we work inside the hospital doing rounds on patients that have been hospitalized. We start off their one-liner or their sentence that sort of says, 47-year-old man who's here with diabetes, hypertension, high cholesterol, and heart disease. And we just sort of kept hearing that over and over and over again with the different patients. And it wasn't just that these people happened to have the bad luck or the bad genes, that they had these 4 or 5 things in common. It's that what they were doing with their day-to-day was creating this cascade that led to multiple manifestations of the same thing, which is my old mentor used to say, fire in the arteries, which is this level of chronic inflammation. Is a phrase that you hear a lot, or just damage on so many levels that affect so many different processes in the body. And what I think a big reason why we are not seeing the outcomes in modern medicine for chronic illness that we wish we were is that I will treat diabetes and expect the diabetes to get better, but maybe I'm not focusing on everything else. Or you get a stent to open up a artery around your heart, not really realizing, of course, that all of the arteries in your body have been affected by these same processes. And so we do have to think about the whole creature, the whole person, the whole organism, and figure out how to not just fix one artery, but to fix them all with what we do and how we live.
Mm. When you were in medical school, and I want to get into your backstory too, that journey that brought you here, but when you were in medical school, was any of that like not connecting fully for you? This almost like this isolation of, this disease. Did you feel that innately, that there was a disconnect?
I was mostly ignorant to it, to tell you the truth, to be totally honest. I mean, I wanted to do well in my classes. I wanted to, make the grade and get the marks and make my, teachers happy and all that kind of stuff. And so when we were learning about high blood pressure, I focused on high blood pressure and learned the things that you were supposed to memorize and how to treat it and whatnot. But I was so just totally wrapped up in the way that it was presented to me, that this was the only way that it could be. And this is there's a bunch of smart people who are teaching me this, and this paradigm must be the best way. And we had some exposure. I took an elective, I remember, in complementary and alternative medicine is what it was called. And hearing some things like, oh, well, acupuncture can do this and homeopathy can do this. And so I was starting to realize that there are other ways to go about them. But I didn't really see the unification of all of these processes until I'd been out in practice, until I'd been learning more about lifestyle medicine. Dean Ornish says it really well in his latest book, Undo It, where he says, look, it turns out that it all boils down to eat well, move more, stress less, and love more. And that sort of very simplistic one-liner can encompass so much of how we can heal so many of these sometimes appearing separate conditions, heal them all at once.
And doesn't that plant the seeds to that there's something more than just what you read and what you learn and memorize? Doesn't it encourage us as a human race that love does play a part in this? So how can I love more, right? You don't read a book, okay, how do I love more? It's like you got to go out and experience, like, what is it like to meet that person that really fires you up inside, and how can you meet them with love? And so it's through experience, and it sounds like what you did, the memorization, the education, you actually had to experience this with more and more clients to understand that it evolves into something bigger.
Mm-hmm. Yeah, and I think some of that had to do with, I was born and raised in Texas and did this pretty traditional medical model. And then I came out to Northern California, which is different in some ways for those of you who've been in Texas and in Northern California. A little more open to some of these, different approaches. And if you had told me when I was in the middle of medical school that, there were studies that showed that hate and anger are tied to heart disease and mortality, and that love can be tied to living healthier and having better control of your diabetes, I'd say this is, it's a little bit crazy. It's not something that I had all been exposed to that degree. But now, as I realize how absolutely complex the body is and how sort of foolish we are to think that changing this one pathway, quote unquote, with a medicine is going to just do what we think it's going to do. The body is just extremely complex, more so than we'll ever fully understand. And so we just need to walk around the world with our eyes open and our ears open to think of all these different possibilities.
Yeah, I think we grew up in New England and very set in the ways of the patterns there, and I guess I'm speaking for myself. Just moving somewhere else, literally just opened my eyes. We moved to Colorado, like Boulder, and it was like, oh my goodness. And then we moved back east and we had an appreciation. We had a more understanding of like, whoa, this isn't how it has to be. This is just what this area has joined in together on as their belief system. And then we moved to California, and then it was like, blew everything up in terms of like what is possible and what you can do and what you can't do. And like, but I feel it's a really important piece to move and get out and experience different communities and lifestyles. I think it's easy to get into the patterns, right? I'm sure in Texas it was completely normal to have like rib night or barbecue night, like that was just natural. But there's other ways to do it with replacement, objects of food. There's different things that you can do. So it just opens up the possibilities a little bit more. And I think we all can just get out of and travel a little bit more, get out of our own communities. Yeah.
Yeah. And I like how the moving back is also educational, because it's the more places you've gone and the more, back and forth that you have, I go back to Texas like I did actually last week. And I spoke at the 4th annual Corpus Christi Veg Fest, my hometown, and they're having a Veg Fest now. And you see, actually there was some of this going on all this time, but I just wasn't on the right frequency. And then you go back to Northern California and you see, that there's still rib night down the street, but it's a different frequency. And the more you travel, in my experience, the more I've seen both. I think the sweeping commonalities and generalizations, but then also some of the subtleties, especially with moving around the country and outside the country with my experience working in Latin America and Africa.
Yeah, I'm glad you just touched upon your backstory a little bit. So you grew up in South Texas, and I believe you did your residency up in Santa Rosa. So. And it sounds like, and correct me if I'm wrong, but when you went up to Northern California, is that perhaps where things started to expand for you, like lifestyle-wise, as far as like, oh, well, wait, medicine can actually be this full spectrum picture. Is that correct? Mm-hmm.
Sure. That was a big part of it, both initially with the move and to see different lifestyle amongst the people that were tied to the residency where I did my training. And then little by little after that, as I learned more from these people like Dr. Ornish and Dr. Clapper and Dr. McDougall and Dr. Greger and all those folks.
So when does your plant-based story come in here, your shift to plant-based eating?
Yeah. Much more recently, a lot of my medical career, let's see, I've been out of residency since 2007. And a lot of my medical schooling and residency and medical career early on were working internationally. And my focus was on, kids and families with HIV, tuberculosis, malnutrition, malaria, that sort of a thing. And I think we did a pretty good job treating those illnesses acutely. But when I came back to the States and was starting my family and was putting down some roots here, I was reminded by how frustrating an experience it can be to work in our system with trying to see a whole bunch of patients in a short amount of time and expecting to do more than just put a Band-Aid on. And my hat's off to the primary care docs who do a good job with that, with a 15-minute visit, which is often, of course, your face-to-face time is much less than that. And I struggled with that, and was also commuting, I still do, but less so now, but was also commuting quite a while to get to my job, to see a whole bunch of patients in a short amount of time and feel like maybe I wasn't making a big change in their life. And then when I heard about lifestyle medicine as a specialty, and that, oh wow, there's actually decades and decades of great scientific evidence that shows that by taking the harmful substances out of your daily life and putting more of the healthful substances in your daily life, that you can make lasting change on a level that pills and procedures will never really do. So that changed my vision for what I could do here in the United States, and frankly, I guess around the world as well, since unfortunately these chronic illnesses are becoming more and more prevalent, even in the places where I was working internationally before.
And when did your shift to eating more plant-based? What was that moment? Was it a moment, or was it a gradual shift?
It was a series of moments. The first was in 2000, when I was in my last year of university down in South Texas, close to the Texas-Mexico border. And it was just a random HBO special on factory farms. And it was, I was probably 21 or something at that age, 22, something. And I had known nothing about that beforehand, and it was just amazing how I had gone through 4 years of college, and we all feel pretty educated and smart at the end of our years of study, and feel like we don't know it all, but we know a whole lot. And then I saw that and I was like, wow, I had no idea that this is what's been going on. And so that is when I stopped eating meats, but I kept eating, I guess, for various reasons, but mostly because I figured, it's not as bad, but I kept eating cheese and dairy and all those other things. And then when years later, so that was back in 2000, but then years later when I met my wife, which was in about 2013, and started eating with her, I realized how I was eating unhealthfully still, that even though I was eating more veggies and stuff that I did maybe when I was younger, I still ate a bunch of stuff that wasn't good for my body and wasn't good for the planet, really. And she eats a lot more whole food, plant-based than I was at the time, for sure. And so, I'd make my beans, and she'd come by with 2 handfuls of chopped up kale and parsley and throw it in there, and threw me for a loop at the beginning, but realized that it was actually good for me. And then I learned the science behind it, and did the studying, and realized that wow, this really is the way to go for health. Yeah.
So how do you begin to integrate that into your your meetings or your sessions with patients? Because you're still in this model that's saying like, okay, you've got 15 minutes and you've got to commute and you've got to do all that stuff. It's got to be really stressful. How do you begin to integrate that into your medicine?
Yeah. Well, for one, I never really talked about being vegetarian for those 15 so years before I went more whole food plant based, because it was sort of like taboo. You don't talk really about politics or about religion or about your eating, whether you're a vegetarian or whatever. That was definitely considered taboo in my training. And so I just thought, this is just something I'm doing predominantly for the animals and for the environment, and that's where I was for a long time. But then the more and more I learned about the science about the health, I was just like, well, this is ridiculous that we're not talking about this. I'm not going to share this with my patients to try to convince them to do it for some, I guess, personal political reason, as much as I know that my decisions are shaded by that, or are influenced by that. But I really want to talk to them about it for their health, because now that I have seen that, I can't unsee what I've seen about the benefits of it. So now it's sort of like, if you've learned about this amazing therapeutic that has just come out, that's been produced by the pharmaceutical companies, that's going to, reverse your diabetes and clear up your arteries and prevent cancer and help you lose weight, like, it would be malpractice not to talk about it. And so, now, if I'm in a busy session where I do a lot of obstetrics care, and so sometimes you've got a whole bunch of things happening in a hurry, and you've got maybe a bunch of patients that you're seeing in a hurry. You get a quick feel for where that person is. And maybe it's, and you try not to make assumptions, right? Because, I could be in inner city, Oakland area, with a patient who, you have this bias that's part of society to say, oh, she's never thought about veganism or whole food plant-based, and she's like, yeah, I did the whole food plant-based thing for a year, and these are my challenges. And you're like, oh yeah, so it's a good thing not to assume these things. But you see where they are in when it comes to their eating habits, and you can you can make short suggestions like, hey, we're wrapping up our visit right now, but I just saw a movie that you might like, and you should check out, Forks Over Knives, or The Game Changers, or Fed Up, or various movies, kind of getting a feel for where they may be, what might move them, what is their pivot point for change. And it might just be, here, check out this website, check out this movie. I usually don't say read this book. That's quite a commitment for all of us who are very busy. And then I send myself a reminder to say, check in with Gloria about whether or not she saw this movie. And it might be that I just send her a message later on my own time, or while I'm in between patients or whatever. But then other times when you're not in a big hurry, you've got lots and lots of time to talk about these things. And so that's one of the beauties of my more current practice is, I'm like, we're going to make 30 minutes the minimum amount of time that we're going to be face to face. And that's going to let us to go a little bit deeper about these things. And yesterday I had this just kind of perfect day where I woke up, I had time to go for a run with my wife and our dog. And then it was a trail run. It was, autumn, it's beautiful. And then I got back and I ate a great breakfast. And then I got on my bicycle and bicycled over to a patient's house. And we got to chat in her kitchen and look in her fridge and learn more about where she was and what she was working on, and had over an hour with her. And like, this was a very different type of medicine that I'm so lucky to be able to be getting into right now, in addition to the telehealth visits through Plant Based TeleHealth.
What's the fulfillment factor, or what's the fulfillment level in that versus what you were doing before? Share.
Oh man, I mean, it's when you're at it's not a great comparison, but when you're at a party and there or a social gathering, whatever, and there's like 20 people that you haven't seen and you want to see, but there's not time to really talk to anybody very much. And you feel, I will often feel like, man, I have to say hi to this person. I have to say hi to this person. And you touch on some things, and there's some growth in there, and there's some fun in there, but it's like these sort of superficial conversations often. But then you go on a walk with one of those old friends that you haven't seen for a while, and you have an hour to talk about things, and it gets so much more deep, so much more real. And you see the change that can happen from that in that one encounter that you didn't quite get with 20 short encounters. And so that was I guess that's a little bit of a comparison between yesterday's visit and some of my busier days. And it's not to say that the busier days, of course, this is a reality that we're stuck in with our medical model that we follow in the US and in so many other countries, where you got to see a whole bunch of patients to keep the lights on and the doors open and everyone making the salary that they feel like they deserve and all that kind of stuff. But I sure felt like it was more meaningful.
Is that the roadblock? Is that if you can pinpoint it, it's just time? Do you think that if you can narrow things down, and I know that's, there's a lot going on, but could you narrow it down to just lack of time available for each unique patient, each unique spirit?
So sure, lack of time is crucial, but I don't know how much of it's this, it's lack of time because all these people need to be seen, and so we just have to work to get them all in, or how much of it is just like, well, our reimbursement also happens to be per patient that we see, not how healthy we help them stay. And there's reimbursement tied to procedures, and there's reimbursement tied to not so much to outcomes, but to just doing things. And that works really well for the companies that make the pills and that make the procedures. And it's the model that we work in. And so by seeing, 4 patients in a day instead of 14, that's 10 patients that didn't get to be seen at all, and they may be suffering. So there's that, unbeknownst to me because I didn't see them today. But, if you do a better job for those 4 patients, then you might not need to see them as frequently, and they're not going to have as many of the same illnesses, or their illness is going to be better, and they're going to skip the procedures. And so I'm not able to work these algorithms completely, but being theoretical about it, I think the needs will be met if we make the visit about quality and less about just seeing a whole bunch of patients in a small amount of time.
Do you feel like, I do, but do you feel like we're going to be seeing more and more doctors, healthcare professionals rising up, like Dr. Marbus, and creating Plant Based TeleHealth? We have an athlete on our team who's a physician, and she just opened her private practice. And she, if I'm not misspeaking, like, isn't working with insurance companies, like really wants to care, help these patients heal. Do you feel like we're going to be seeing more and more of that? I mean, is that not just optimism, but a growing reality?
I think there's objective data that, yes, the numbers are increasing. It is I keep talking about Dr. Ornish today, but he says it's a wave that lifestyle medicine is a wave that hasn't begun to crest yet. And I'm actually sitting for my lifestyle medicine boards. I've been doing this based off the learning that I've done, but now decided to go ahead and get boarded in it. And I think there's just more and more people being boarded every year. It's a relatively new specialty. And the information is getting out there that this is a medical model that is it helps some people and helps a lot of people on the acute. The current medical model helps people with acute illness, and thank goodness we've got stents for acute heart attacks, and we've got clot busters for acute major strokes, and all this kind of stuff. But we're just not doing a great job with a lot of chronic health, and that's where lifestyle medicine comes in part. So we hopefully don't bankrupt our entire economy, but of course with the main goal of helping to keep people healthy. And you see so many people practicing more in this way now than years past, and it's becoming less of a crazy thing to say that eating your vegetables will help you with your heart disease, and it doesn't have to be manufactured and put in a little bottle and cost you $1,000 a month.
Yeah, that's true, right? Like sometimes it costs that much per month for someone to be. Yeah.
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 These chronic conditions are so expensive, and they're expensive when it comes to time lost from work and early death and disability. And
it's talking about economic impact. Sorry to interrupt, but like, isn't that economic impact right there? But I just think that healthier, happier people, we're going to figure out the economy.
Yeah.
We'll figure it out.
Yeah.
If that whole thing falls because everybody's healthier and happier, I think we'll figure it. That's like, I've heard the argument. I love this argument. Well, if we stop eating animals, we're going to be like overrun
Populated
by
by
animals.
Yeah. Watch out, the cows are in my living room again. I wish I was still eating meat. Yeah. No, there's holes in all these arguments. But it's good to debate them. Yeah. Good to talk about them.
So let's talk a little bit about lifestyle medicine. Like, as I alluded to in the intro, like, it's not just one thing. Like, it's actually not just diet, right?
Sure.
And it's not just exercise. Like, we see, and I think BJ and I have also lived this, although we have always been healthy, quote unquote, doing the best we can with the information we have. There was definitely a time at the beginning of like our endurance sports career where it was like, well, we would okay, I'm going to speak for myself. I would exercise so I could eat. You know, like I can eat whatever I want. I can have French fries. I can have 3 beers. I can
Ben and Jerry's ice cream.
Oh yeah, that was you.
Yeah.
Ben and Jerry's ice cream. But now it's like you can't exercise yourself out of a bad diet. So it's everything. But I'd like to know the components of how you articulate lifestyle medicine.
Yes, thank you for bringing that up. It is living a healthy life is not just about diet, though it is one of the most important. But the 6 pillars of lifestyle medicine that you'll hear as you talk to your lifestyle medicine docs that come on your show, eating a predominantly plant-based diet, if not exclusively, having daily movement with a goal of at least 150 minutes of aerobic exercise a week and 2 days of strength training per week, which something tells me you guys are making those 150 minutes.
Yeah, we're sliding into that curve. Yeah,
that's right. While we're talking, yeah. But for obviously for the majority of America, that sounds like a very difficult goal to reach, and you will hear that sitting is the new smoking, and we have become a nation of people who sit, and I'm sitting right now as we talk, and I think this is an important conversation to have, but I'm not out, lifting cows or anything right now at this point, so I'm not exercising at the moment, but
you will if you keep eating vegetables.
That's right.
And making people vegan.
How many cows have you lifted today, hon? Well, I'm on number 5, so I've met my quota. But so movement, and Dan Buettner, who's done so much amazing work with the Blue Zones, reminds us that it should just be little nudges that are built into our life. If we have trouble convincing ourselves to put on the spandex and go in for a swim, bike, run, we can at least make sure that we've parked further away from the grocery store entrance, and these little things that just add up. And surely we could talk more about exercise, but I'll cover the rest of the pillars real quick. If it was diet and exercise, and then there's sleep, and that was something that was certainly not emphasized in my training. Just the importance of sleep, and not just how to diagnose obstructive sleep apnea or restless leg syndrome, which are, of course, important conditions to be knowledgeable about, but knowing that your cortisol is higher, and your sugars will be higher if you're not sleeping enough, and your stress levels and your heart disease risk are higher when you are sleeping poorly and sleeping not enough. So sleep is an important component, and then there's stressing, anxiety, depression, and mental health in general. So having time for mindfulness and meditation. And then the avoidance of harmful substances is the fifth pillar. And we can all agree that it's not good to smoke. And so working on that, there's a little bit of disagreement amongst if there's such a thing as healthy alcohol, but in general, trying to minimize or avoid it completely, depending on where you are in that part of the debate. And then lastly, having community, and that ties in with the love that we were talking about earlier, and how we are social animals, and how hearing you to talk about the benefits that you've had as you work on your podcast and build your community, and how much you are motivated by the people you work with and train with, and many examples out there.
Yeah.
Yeah, I think we were put into a major blockage with everything that just happened over the past, year and a half of like, no, we're shutting down community. And then we created a whole bunch of patterns, maybe not aware of the patterns that we created during that time. And now it's the community's opening back up, and we're sort of still rolling in some patterns that we created, and we're trying to get ourselves off of them. And I feel before all of this, the community was strong. Like, you had support, and then we were shunned to our, sentenced to our houses for a while in seclusion. And if you didn't have the tools or awareness to sort of work through that on your own, what would you do? Like, I think a lot of those pillars that you just talked about would be thrown out the window. It's just like, I'm just trying to get up and make it today and see if, I have work today. So all those factors together, I think, really, really paint a picture of a long-term lifestyle. So lifestyle medicine is long-term. So as you work with patients with these pillars, like, we're telling them not, and I'm sure they're coming to you for a specific reason, but we're working with a short-term solution versus this long, and let's call it boring, right? It's not sexy, right? You're telling me every day I have to exercise, every day I have to meditate, every day I have to have community, right? But for the long term, if these become our default, aren't we going to be the support for the others in the community? Like, aren't we going to be the example just by doing the things that over long term are going to help us, not taking that short-term solution?
Yeah. I think short-term a pill to get us to sleep better tonight can be helpful as we are working on our bigger goals. And but we just can't. This pill tonight or for the next couple of nights shouldn't turn into we need a pill every night for the next 20 years of our lives to sleep. But so yes, it requires this sort of a little bit every day. I think that was actually a quote of yours, Beach, about just a little bit, every day, and it all adds up. And we need motivation from others, and then before you know it, you end up being motivation for someone else yourself. And I totally agree with what you're saying about the difficulty of this period with COVID, and it's been a rough time, and it's been a time for both, I'm just going to sit and veg with Netflix and eat whatever and drink whatever. But then it's also been a period of introspection and saying, well, it's also a great opportunity to work on these other challenges that I've had in my life and try to come out stronger in some ways. And granted, everybody's story has been different in it. I mean, I live in a part of the world that has pretty mild winters. And, when we're not choking on the smoke from wildfires, it's a beautiful place to be outside during COVID. I could work in my garden. I could play with my family. And do all these things, whereas somebody cooped up in a little apartment in Brooklyn or Manhattan or whatever didn't necessarily have the same opportunities. And so we all, and that's just one of many, obviously, differences. But as we're coming out of it, we have the time to look back and say, okay, how did I pass this time? What did I do well? What can I do better? And now it's time to keep looking forward as well.
Yeah, I think that's a good practice for every day. Mm-hmm. You know, like our meditation teacher has us make these lists, like I promise the universe list. Today I promise the universe that I will, pay the credit card. I'll catch up on QuickBooks. I'll write the intro for Dr. Pierce's interview. And then at the end of the night, you look back on your promise the universe list and you say, okay, what did I do well? What did I miss? And the things that you miss go on the top of the list the next day, right? So I think that we can always be in feedback within ourselves, like, okay, and celebrating our victories too. I think it's so we kind of are in this society that leans towards how far we have to go. And there was a lot of people who, a lot of people didn't fare very well over 2020, but a lot of people did. A lot of people woke up. A lot of people said, oh man, this is it. This is my opportunity to go in. This is my opportunity to do less. This is my opportunity to, clean up my act and get my health to a level where I'm feeling safer in my own body and my own immunity. So I want to talk a little bit about, not a little bit, I don't want to minimize it. I want to talk about your work with obstetrics and working with, women who are looking to get pregnant, women who are changes that you've seen, perhaps the power of this medicine on the successful gestation of, the cycle of life.
It's pretty powerful. It's powerful also to see it from a light that is from a point of view that's quite different from, I think, a lot of people in the medical community. Because when you say, oh, I'm vegan or I'm exclusively whole food plant-based, the first thing that comes to most minds who trained in our system is, okay, what are their deficiencies? Oh my goodness, she's probably deficient in vitamin B12, and is she going to get enough protein? And what is the risk to this baby? And I think coming from a point of view of trying to prevent harm, those are good intentions. But it's nice to have learned more about it since that introductory to the idea of, well, let's catch all the deficiencies that might be in there, to really realizing that eating this way is better than, it's not only as good as, but better than eating and living the lives that so many of us live in the United States now. And so there are great recommendations from national dietary groups that say a well-balanced, thought out vegan, whole food plant-based diet are beneficial, healthy, just fine, and you don't need to worry about that your baby's going to come out and be half of the size of a normal baby or something like that, and never make it to graduation from kindergarten. And there are lots of mistakes that we all make in eating, in the sense of, well, let's see, my best friend told me that I got to eat meat at least a couple of times a day when I'm pregnant. And my other best friend said that, there might be too many pesticides in kale and chard, and so I'm going to avoid that. And so I think having a trusted medical provider who's been able to do some extra reading and learning and research in what whole food plant-based means in pregnancy, having good access to some good books. There's the book called Nourish by Reshma Shah and Brenda Davis, which has come out in the last year. It's a great look at healthy vegan pregnancies and childhood. And it's a great book for families who are raising their kids in this way of life. And, there's so much information, good, reputable information from these authors available for free online, whatnot. And so this is one of those things where I said earlier that once you know some of the science behind it, you feel like, man, it's almost malpractice not to talk about the benefits. And when you look at the effects that obesity, that eating a diet that's predominantly processed food have on a pregnancy, seeing things like, increased need for C-sections, increased need for vacuum deliveries for babies that are not coming out correctly, increased risk for shoulder dystocias because you had diabetes and your baby's head was delivered but got stuck at the shoulders and then had tons of scary difficulty delivering the baby. Increased risk for heart and high blood pressure issues during pregnancy that are associated with a lot of the conditions that come along with eating a standard American diet and being inactive. And so it's lovely to be able to bring this healthy, pharmaceutical-free healing and medicine to pregnancies.
And do you get to follow through and see the vegan babies?
I usually see them for a postpartum visit, because even though I'm a family doctor right now, I'm not doing like newborn care per se, but it's always a nice visit when a woman that you've been working with and say, the majority of my patients in my sort of inner city underserved practice are not vegan. I've had a handful that are, but then I've had a bunch who are trying some things that they wouldn't have tried otherwise, moving more in that direction. And it's a work in progress for all of us, but it's been great to be on that journey. And then you see them for their postpartum visit, and it's their babies come decked out in the coolest outfits, and the carriage has just got the most beautiful unstained baby blanket on it, and they're proud to show you what has been part of our teamwork for the last 9 months, and that's a special day.
Is there any concern that an expecting mother or father, right, expecting parents should have around having and I'm going to make the discernment between vegan and plant-based, like having a whole food plant-based pregnancy and child, not just through the pregnancy, but raising that child with a whole food plant-based diet? Are there any concerns they need to be looking at?
Sure. So let's see. And I would refer listeners who might be interested, in addition to the book Nourish, there's also great resources on, say, I think it's called Plant Based Health Professionals UK is a great place to look at. They've got some nice little 1-pagers, 2-pagers with information. Physicians Committee for Responsible Medicine, Neil Barnard's group out of Washington, D.C. has some great little 1, 2, 3-pagers on this, and these reputable resources, and of course the stuff that you can find on nutritionfacts.org with Michael Greger's work. You'll have this at your fingertips and not worry about memorizing these things that we talk about today, and be able to be in charge of your own health and your child's health. But you'll add a little bit more calories in second and third trimester per day. You add a little bit more protein, and you make sure you're getting your iron. Of course, you make sure you're getting your folate, your folic acid when you're in first trimester, when your baby's neural tube, which is the brain and spinal cord, is being formed. You want to obviously make sure that you're getting vitamin B12 accurately or in adequate amounts, and that's usually 1,000 micrograms twice a week is one way to do it. But you can also there's other ways to get your vitamin B12 in, and it doesn't. It's impressively straightforward and simple to add an extra half cup of black beans to your food today, and an extra handful of greens, and maybe an extra tablespoon of peanut butter or something like that. So it's amazingly simple and straightforward. There's some debatable stuff. I think there's debate amongst the long chain omega-3 fatty acids, the EPA and DHA that some people get through eating fish or taking fish oil supplements, though we know that there's certainly concerns about mercury and other persistent organopollutants with fish that are higher on the food chain. And humans can change the short chain omega-3s that we get from eating chia seed, flaxseed, and hemp seed, can make them into these longer omega-3s, EPA and DHA, which are important for the developing brain and retina of babies and our own mental wellness, brain health. But we can make these EPA and DHA from short chain amino acids short chain omega-3s, that we eat. But pregnant women can do it more efficiently than men, for example. And so maybe it's not necessary to take an algae-based DHA and EPA, but maybe it is. And so this is an area of research, ongoing research. Some of the very smart people in the field say, to be on the safe side, go ahead and take a little bit of EPA, DHA, and if you're vegan if you're whole food plant-based and you want to get it from a non-animal source, get it from these algae-based supplements. So there's certainly some debate still in the best way to do this, but by and large, it's pretty simple, straightforward stuff. Eat plants, and a variety of them, and you'll probably be okay.
Yeah, and I think it helps with the love factor too. I think like the better you feel, the better you feel. I think that plants, you mentioned a very California word, which I love, frequency. It's a higher frequency, plant foods. So I think it helps with the love factor.
It's lighter, you don't feel as lethargic and heavy.
Cool.
I feel like it's super light, but I don't know where you want to go, but from speaking about food, I know you have a garden. And we're
it sounds like you actually have a house within a garden.
Yeah, it's like the garden is it, and then you have this little place to sleep
That's what
at
it
night.
sounds like. Like your house is in the middle of a garden.
But we have a community garden here. I don't even know how big the plot is. What do you think it is? Our plot, maybe like
20 by
5
feet.
Just this little box, and we're struggling with that. So
in San Diego, where you can grow anything. We know we can grow Swiss chard to the point where I haven't had Swiss chard in a year because it was like too much.
It was
too much Swiss chard.
So what do you have growing, and how do you grow it?
Well, first of all, we
how
need
cool
to
to
get
hear
there.
that you guys garden.
What's that?
How cool to hear that you guys are gardening. That's
My
nice.
God. I do love it. And you know what? I think that if we have any fail in our gardening, it's because we're not there as frequently as we need to be there. Like I ride my bike by it and I'm like, I got to go to the garden because it's in
like less than a mile. Yeah.
There's no excuse. There's no excuse. So anyway, we want to hear about the joys of gardening.
That's awesome. I think I just thought of 3 quotes apropos to what you just said. One is, let's see, you don't have to be good at gardening for gardening to be good for you. I like that one. And so that's okay. You guys don't have to be, none of us are pros at this, but there'll be benefit to have. The second I thought of was that the best gardeners are the ones that have killed the most plants.
So we're experts.
We've just been... Yeah, you're on your way. We've just had more opportunities to get it wrong and have learned from our mistakes. So the longer you do it, the more mistakes you make, the better you'll be. So stick with it, obviously. And the last was the best. I guess the best pesticide or the best way to control the bugs and other things in your garden is the gardener's shadow, which just means, you got to get out there and just look around and see what's going on to be able to maximize it. So it does take a certain amount of commitment and being out there. Yeah. And so when you're busy, and I'm kind of going through a busy period right now, it is both reassuring to know that the plants continue to grow without me being there, but it is also a challenge because when I do go out and I see that the tops of, the majority of my beloved purple kale that I had just planted had been taken off by, a rat, I'm almost positive. I do realize that my absence has allowed some others to flourish. And for all of the rat lovers out there, that you'll be quite happy that I'm feeding them on a regular basis now. But it does involve getting out there and doing a little bit of work, and when you're busy, it's
I
just
like the
tough.
farmer's shadow. I'm going to get more shadow
Yeah.
out there. Yeah, that's just it. Because
Yeah.
we have, like, there's owls, there's rats,
There's something
there's
digging underneath.
there's something going underneath, there's something coming from above. It's like, and I'm happy to share the garden. I'm happy. And it's funny how sometimes they're like, no, I'm all set with the Swiss chard, but I love the cucumbers, or I love the tomatoes where there's 8 million tomatoes, but they won't eat the tomatoes. They'll eat, the thing that we have like one little sprig of.
Yeah. Could you please eat the chard for
my
me?
God.
Because I'm tired of the chard for the
Seriously.
moment. I could put little signs out there. But yeah, you get outside, you put your shadow on the garden. You're soaking up the vitamin D in the meantime, which is for people who don't get to go for a lot of runs and bikes and swim outdoors and stuff. It's a great opportunity to get that vitamin D soaked up. And you guys being in San Diego area, can get some good vitamin D from that sun most of the year, if not all year. It's a little bit harder the further away you get from the equator. But you asked Beej what I'm growing. We're growing a whole lot of things right now, and maybe it's the shotgun method because we grow a whole bunch of things and we don't feel all that bad when something doesn't flourish. And if that was the only thing we had grown and it didn't flourish, then that would be a bigger hit to us, both mentally, and if we were depending on it as our only source of calories, of course, it would be risky. And financially, for those poor farmers that, grow nothing but strawberries, and there's a horrible strawberry blight this year, then, that's one of the benefits of being polycultural, or of growing all sorts of different things when you can. So yeah, we do a whole lot of fruit trees and fruit bushes, and freeze the surplus in parts of the year when it's there, and have it. So I put some wildly harvested blackberries from our aunt's property, and that would have that's a lot went to the birds, obviously, but we got to put some in a big freezer bag, and I put some on my oatmeal this morning when you're starting to get out of season. But anyway, the figs are going right now, and we're starting to put in stuff for the winter because we have, as long as you get stuff growing before it gets too cold and the day length gets too short, then you'll have some nice brassica-related stuff to eat all winter. And man, if you want to pick one food that's going to help keep your fire in your arteries down, it's eating things in the broccoli family. And so, we can't grow the big head. We almost never grow these beautiful heads of broccoli or cauliflower that you see in the stores. We usually get things that are a little bit wimpier looking, but we get enough of it because we've planted enough of our ground with those families. So, if our broccoli doesn't do great, I can still eat the leaves. And if a rat eats the purple kale, then we still have some pak choi in another bed around the corner where he just hasn't gotten to yet. So
Why is broccoli?
that's what
Why
we
is
got
the
going.
broccoli family so good?
Yeah, I mean, so on a biochemical level, there are these things called isothiocyanates, which have anti-cancer properties, and I don't know if it's that portion or other parts of the broccoli family stuff that's also good for your heart health. Clearly, the nitrates, being able to keep your blood vessels open, as Dr. Caldwell Esselstyn, who's done so much work in cardiology, will remind us to try to eat greens as much as we can throughout the day to keep our blood vessels healthy. But a lot of these components of plants are there to help keep the insects away, and they're off-putting when a bug starts munching on it. But because of this interplay with the microbiome that covers the plant and what's inside of it, and our microbiome and our relationship with plants over the millennia, we eat them and it doesn't make us sick. It makes us healthy. It's I don't know if we certainly don't fully understand how that has evolved, but those are some of the things in that group of foods. That is why we try to either put them in our cooking as we're making our curry or our beans or whatever, or we just chop them up and put them on top when we've reheated our stuff and just put a helping on top.
Well, it sure sounds like we're meant to eat plants from that statement you just made. And as we wrap this up, I'm noticing your sweet Patagonia plant-based telehealth sweatshirt. Love it. I love that they sprung for the Patagonia. You gotta go. You gotta go for the good stuff. How has your experience been working with them so far? I think you've been there about 9 months or so.
It sounds about right. I can't recall the exact month right now, but I came on maybe I was about the fourth in the team, and there are 9 of us, going to be 10, I believe, before the year wraps up. And how nice to have a group of smart, compassionate docs that have experience in so many different parts of lifestyle medicine that we can just feel like we're part of a great team, and we can bounce things off of each other. And we can say, this patient reached out. I'd love to be able to work with them, but I'm not licensed in Wyoming, but you are. I'm going to introduce you guys. And so it's great to be able to have these opportunities, like I said, 30 or 60-minute visits where we can talk about some changes that are not only going to really turn around that person's health, but also will be, helping the environment. I don't get to. I certainly don't write a letter to my congressperson every day to say I want you guys to focus on making sure our Earth doesn't burn up because of what we're doing. But by eating the way I eat, and but eating the way that we eat, and by being able to recommend these lifestyle changes to our patients, we're able to have an effect on helping out the planet one little bit just about every day. And I find that is a total privilege to be able to say that I do that. And I'm really proud to be part of this group, and thankful that I have this opportunity to do something that has a far reach.
And someone who's listening to this, they're like, "Oh, this is my guy. Like, I need to talk to him. I need to have a conversation." It might be like 2 hours. How do they start that process? Like, so they hear you, and what's the next step?
Sure. So plantbasedtelehealth.com is easy to navigate website, and it helps to get you to the doc that you want to see. And you have to be, for me personally, I have a license in California, Texas, and Florida. And if you like what you're hearing me say, but you live in another one of those states, you should feel comfortable that everyone else on the team has pretty similar ways to approach things. Just go to the website and schedule an appointment, and we'll make it happen.
It's so cool. I think that there's something that is going on behind the scenes there within the community of doctors that you guys have, is this support system, and really this like this brain trust, right? Like, you're all very, very brilliant people, a lot of experience, and you found your way to this place of health, which is not so much the consensus thinking, especially, it's not the Western model, but it incorporates those things and it honors those things when they're appropriate. And I just think that there's something really powerful happening, like on those conference calls and behind the scenes, that is going to benefit the collective greatly. So I'm so grateful to Dr. Marbas for being on the show and then introducing us to all of you guys. So, we're going to continue to bring you guys on, and I don't know, this might be a lifelong thing. It's like, as you keep adding people, we're already all set up for like the next year of interviews, but it's such an honor. So, thank you so much for your time today. It was great to connect with you, and certainly we'll let you know if we're up in that Santa Rosa area again. We love it up there.
Please do. Thanks so much for helping us to spread the word. We're a relatively new organization, and we really appreciate the opportunity as well to meet you guys and to meet the folks that listen to your message.
Awesome. Thank you so much. We really appreciate it.